Dear audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 18th lecture on pathology. Today, day 4 lecture on inflammation. In the last day 3 lecture on inflammation, I have told you about the cellular events of acute inflammation up to chemotaxis. Today now come to phagocytosis and release of leukocyte products First come to phagocytosis. What we mean by about phagocytosis? Engulfment of foreign particulate material by phagocytic cell is called phagocytosis. Engulfment of foreign particulate material by phagocytic cell is called phagocytosis. Dear audience, before going to discuss about phagocytosis, we can recapitulate another term, that is endocytosis. What we mean by about endocytosis? Endocytosis includes, one is phagocytosis, this phagocytosis is nothing but cellular eating. When the cell eats the solid material, then it is called cellular eating, or it is called phagocytosis. Another is pinocytosis. It is called cell drinking or cellular drinking. It is nothing but the engulfment of the liquid or fluid. An engulfment of solid is called phagocytosis. Engulfment of liquid or fluid is called pinocytosis. And these two under the heading of endocytosis. Now we are talking about the phagocytosis. Now come to what are the cells that are associated with phagocytosis, that is phagocytic cells. Now come to phagocytic cells. Name of phagocytic cells. The cells that are associated with phagocytosis, these are called phagocytic cells. These phagocytic cells may be macrophage, neutrophil, eosinophil, basophil, and natural killer cell. Dear audience, these are the phagocytic cells. Natural killer cells, although it does not engulf the foreign particulate material, but this is associated with the lysis of the cell. Although it is associated with lysis of the cells, it is still under the heading of phagocytic cells. Now come to steps of phagocytosis. Steps of phagocytosis. One is opsonization, recognition and attachment, recognition and attachment, recognition and attachment, then engulfment, and killing and degradation. Killing and degradation. Now come to opsonization. What do you mean about opsonization? Opsonization means wrapping of substance to be phagocytosed by opsonin is called opsonization. Dear audience, I have told you in the last lecture, in chemotaxis, if it is the blood vessel, endothelial lining, and if these are the causative agents of inflammation and infection, the WBC, that is neutrophil, comes out of the blood vessel tissue by the process of diaperesis, and it moves towards the attractant, and this is the chemotaxis. Now come to opsonization. Wrapping of substances to be phagocytosed by opsonin is called opsonization. If this is the opsonin, the opsonin causes wrapping of the substance to be phagocytosed. Suppose this is a bacteria to be phagocytosed by the phagocytic cell. Before phagocytosis, this organism is wrapped by a material or substance. This is opsonin. So wrapping of substances to be phagocytosed by opsonin is called opsonization. So this is the opsonized bacteria. Now come to what is opsonin. These are the naturally occurring substances. Required for opsonization is called opsonin. So these are the naturally occurring substances required for opsonization. Now come to some names of opsonin. Name of opsonin. One is C3b. It is one of the product of complement system. Then IgG, immunoglobulin G, subtype 1 and 3. Another is colectin. So these are the opsonins, and these are naturally occurring substances. Now come to recognition and attachment. Dear audience, this is the opsonized material. Around it, this is the opsonin. This is opsonized material, opsonized. And this is the neutrophil or acute inflammatory cell. How the acute inflammatory cell recognizes it and then attaches with it. This is recognition and attachment. How to recognize? Phagocytic cell has receptor for opsonin. So, phagocytic cell has receptor for opsonin, and this is the receptor on it for the opsonins. As phagocytic cell has receptor for opsonin, the phagocytic cell binds with the opsonized material, that is binds with the opsonin of the opsonized material. Phagocytic cell has receptor for opsonin. It recognizes the opsonin and then attaches with the opsonized material. So, due to presence of receptor for opsonin on the phagocytic cell, it can recognize the opsonin of the opsonized material, then it attaches with the opsonized material, and this is recognition and attachment. What happens after attachment? After attachment, this step is engulfment of the opsonized material. Now come to engulfment of opsonized material. Opsonized material. Again, if this is the opsonized material or bacteria, it will be engulfed by the phagocytic cell. This is engulfment of opsonized material. How? After attachment with the phagocytic cell, if the phagocytic cell, it attaches with the opsonized material. What happens then? The phagocytic cell produces pseudopodia on both sides of the opsonized material. Phagocytic cell produces pseudopodia on both sides of opsonized material or both sides of bacteria, like this. These are the pseudopodia. Then the both pseudopodia fuses at a limiting plate. What happens then? Then fusion of both pseudopodia. Fusion of both pseudopodia like this. And this is the nucleus, and there is lysosomal bag. Now, after fusion of these two pseudopodia, there is formation of a membrane-bound vacuole, and that vacuole contains the bacteria, and this is called phagosome. So, after fusion of two pseudopodia, a membrane bound vacuole is formed called phagosome, and this vacuole contains the bacteria. Later on, what happens? Later on, the lysosomal bag fuses with this phagosome. What happens later on? This is a phagosome and this is a nucleus, and there is fusion of this lysosomal bag along with the phagosome. This is lysosomal bag, and a common membrane bound vacuole is formed. This is called phagolysosome. Later what happens? Lysosomal bag fuses with phagosome and forms phagolysosome. Later on, now the bacteria is within the phagocytic cell, within the cytoplasm of phagocytic cell, within the phagolysosome of the phagocytic cell. Then there is killing of degradation of the bacteria. Now come to killing and degradation. Killing and degradation of bacteria. How killing and degradation of bacteria occurs within the phagocytic cell? There are two ways of killing and degradation. One is oxygen dependent pathway of killing and degradation. Another is oxygen independent pathway of killing and degradation. First come to oxygen dependent pathway. What occurs in this pathway? In this pathway, you know, superoxide is a free radical. In this pathway, what happens? Superoxide undergo spontaneous conversion to form hydrogen peroxide. So hydrogen peroxide is formed due to spontaneous conversion of superoxide. This hydrogen peroxide is bactericidal. It is bactericidal. And this hydrogen peroxide is the agent that causes lysis of the bacteria. How this hydrogen peroxide causes lysis of the bacteria or causes killing and degradation of bacteria? and this lysis may be myeloperoxidase dependent and it may be myeloperoxidase independent also. So killing of bacteria and degradation of bacteria by hydrogen peroxide may be one myeloperoxidase dependent or it may be myeloperoxidase independent. So this is the oxygen dependent pathway of killing and degradation. Now come to oxygen independent pathway. Oxygen independent pathway of killing and degradation. How it is carried? It is carried by two things. One is the BPI protein, bactericidal permeability increasing protein. It is BPI, bactericidal permeability increasing protein. This protein is present within the cytoplasm of the phagocytic cell and it is associated with the killing and degradation. And another is lysosomal enzymes. So these are associated with the oxygen independent pathway of killing and degradation. Now come to how BPI causes killing and degradation. What is the role of BPI to cause killing and degradation? How BPI causes killing and degradation. Dear audience, suppose this is the bacteria, and this is the bacterial wall. Suppose this is the phagocytic cell. It has engulfed the bacteria, opsonized bacteria, and there is BPI protein and there is nucleus also here. This BPI protein, what it does to kill the bacteria? BPI activates phospholipase. BPI activates phospholipase. So there is lipid peroxidation. In bacterial cell wall. So BPI acts upon here, it activates the phospholipase enzyme and there is lipid peroxidation throughout the wall. As there is lipid peroxidation in the wall of the bacteria, what will happen? The bacterial wall becomes weak. Bacterial wall becomes weak. As the bacterial wall becomes weak, there is formation of multiple holes in the bacterial wall. Formation of multiple holes in the bacterial wall. Formation of multiple holes in bacterial wall. As there is formation of multiple holes in bacterial wall, from the phagocytic cell cytoplasm, water comes in the bacterial cell. So water from the phagocytic cell comes in the bacterial cell. And due to accumulation of water in the bacterial cell, the bacteria undergo swelling. What happens there? Through the holes, water enters into bacterial cytoplasm. What happens then? Swelling of bacteria. And killing of bacteria. So this is the role of BPI protein in killing and degradation of bacteria. This is all about the killing and degradation. Dear audience, now come to release of leukocyte products. Dear audience, we can recapitulate again. In acute inflammation, in cellular events of acute inflammation, there is chemotaxis. Before that, transmigration of leukocytes from blood vessel to tissue. Now the leukocytes were getting in the tissue, and in the tissue they are associated with the phagocytosis, and in the tissue there is release of leukocyte products. Now come to that point, release of leukocyte products in the tissue in acute inflammation. There are three ways of release of leukocyte products. Three ways. Number one, regurgitation during feeding. Number two, frustrated phagocytosis. And number three, a release of products after death of neutrophil or acute inflammatory cells. So there are three ways. Now come to regurgitation during feeding. Regurgitation during feeding. Dear audience, again we can recapitulate. This is the blood vessel, endothelial lining, and the leukocytes from the blood comes out of the blood vessel, transmigration. Then it moves towards the attractin chemotaxis. Then so many neutrophils there. There is during feeding of bacteria, during feeding of infective agent by the phagocytic cell, there is release of leukocyte products, and this is called regurgitation during feeding. How it occurs? We know this is the Pseudopodia made by phagocytic cell, we know, and this is the lysosomal bag, you know, and this is the nucleus, and this is the bacteria to be phagocytosed. You know, this is the phagosome, and after fusion of lysosomal bag with the phagosome, phagolysosome is formed. If before fusion of two pseudopodia, lysosome fuses with incomplete phagosome. Then there is release of lysosomal enzymes in tissue. Dear audience, I have told you, if before fusion of two Pseudopodia, lysosome fuses with incomplete phagosome, the release of lysosomal enzymes in tissue. These two are the Pseudopodia. This is Pseudopodia, this is Pseudopodia. They will fuse together. After fusion of the Pseudopodia, formation of the complete phagosome. Before fusion of these two Pseudopodia, this is incomplete phagosome. If lysosomal bag fuses with it before the completion of the phagosome, before completion of the fusion, if the lysosomal bag fuses with it, there is a release of lysosomal enzymes in the tissue. So this is called regurgitation during feeding. There is regurgitation during feeding, and these lysosomal enzymes will cause tissue injury. Number 2, frustrated phagocytosis. What do you mean by about it? Dear audience, you know, if this blood vessel endothelial lining, you know, endothelial lining is very smooth. Our endothelial lining is very smooth, and blood flows like this. If immune complex is formed in blood vessel, suppose this is the immune complex made of antigen and antibody. The neutrophil here tries to engulf it. So neutrophil tries to engulf the immune complex on the smooth surface of endothelium. Due to smoothness of endothelium, although the neutrophil produces pseudopodia like this, but neutrophil cannot completely engulf the IC because of smoothness of the endothelium. So there is rupture of the leukocyte and release of leukocyte products. This is called frustration of the leukocyte to phagocytose the IC, and due to rupture of the neutrophil, release of the leukocyte products. This is frustrated phagocytosis. It is also called reverse endocytosis. Dear audience, there is disease, you know, acute glomerulonephritis. Dear audience, you know, acute glomerulonephritis, there is primary and secondary glomerular diseases, and you know the pathogenesis of glomerular disease, the most important pathogenesis is antibody dependent mechanism. What happens here in the glomerular basement membrane? What happens? There is either fixed immune complex or circulating immune complex in the basement membrane of the glomerulus, and this immune complex activates the complement system, and there is acute glomerulonephritis. If frustrated phagocytosis occurs in the glomerular basement membrane or within the glomerulus, if frustrated phagocytosis occurs in the glomerulus or glomerular trapetocapillaries, what will happen? Due to frustrated phagocytosis, there will be release of leukocyte products. So this release of leukocyte products in the glomerulus will enhances the pathogenesis of acute glomerulonephritis. And last one is release of product products after death of neutrophil or phagocytic cell. What it means, again we can recapitulate. In acute inflammation, in the cellular events, the acute inflammatory cells outside the blood vessel in the tissue, and these leukocyte or neutrophils undergo death, and after death of these neutrophil, there is release of leukocyte products in the tissue, and it will cause tissue injury. So this is all about the release of leukocyte products, and this is all about the phagocytosis and release of leukocyte products. To adapt to this, thanks all.